Today marks the start of the week of Maternal Health and Wellness Week. Now, it's also a time to raise awareness about the disparities in maternal health and also the outcomes between Black women and other groups in the U.S. Because did you actually know, get this, that Black women are 3.5 times more likely than white women to experience a pregnancy-related death and complications? According to the National Institutes of Health, that's a shocking number, especially for the Black moms out there hoping to start or even expand their families. This is just a huge deal. So obviously this morning we want to bring in and talk about this issue. We've got Thana Hickman here and also Nicole Behrman. We want to thank you so much for coming and joining us this morning to talk about these really big issues as well. So first, Thana, we're going to start with you. You are the founder and the CEO of Viola's House, which is absolutely incredible, the work that you do. Tell us about Viola's House and why the cause is so important and near and dear to your heart.
At Viola's House, we focus on the social determinants of health by providing food, housing, transportation, economic stability through job training, and most importantly, access to health care.
Yeah, tell us why this is such a big deal, especially among Black women and the Black community.
Because
getting that access.
We see the most disparities with Black women with health care and having the proper access, having the proper insurance, but we also see the most deaths with Black women right here in the U.S. And so it's important that organizations like Viola's House step in to help change those outcomes. We have the tools that we need. We know that the services work, and we've had 100% of zero maternal deaths in our maternity homes since the inception.
Which is incredible. I mean, I have chills, which is incredible. The strides that you guys are able to make and the number of families and women, Black women, that you all are helping at Viola's House.
Absolutely.
Amazing. I want to turn things over to you, Nicole, because you've got a very personal story that you've shared with us and you've trusted us to share us with. You actually lost your little girl in pregnancy complications. Tell us a little bit about this and how that experience was for you.
Just the day before Thanksgiving, my life changed. My daughter had given birth to her, now he is 5 months. She complained of chest pain the day after, which was totally ignored. They told her that was normal after having a baby. She then returned back to the hospital 5 days later, and with the same complications, chest pains, nausea, vomiting. I didn't get the proper diagnosis for her.
Yeah.
She was just given several different pain medications, including morphine, which took her life in 3 minutes.
Oh my goodness. This is issues that obviously don't just impact the mom and the baby, but it impacts the entire family, as we can clearly see with Nicole. So I'm so sorry that this happened to you, your daughter, and your entire family. And Thana, turning things back to you, these are the real issues that you're speaking about that families are constantly having to face. And so you went to D.C. recently. Tell us, what you guys were able to accomplish in D.C.
So we are going to D.C. on Monday. We just had an event here on Tuesday at United Way, a call to action. We are taking that same event to D.C. right across from the White House. We will have legislators there, funders there. We have another family that will be there telling their story so that we can continue to advocate for Black maternal health care. We know right now that the healthcare training is implicitly biased, and we want to advocate for better training so that our moms can live a long life and we don't see the generational impact of losing a mother in a household.
What can we as a society do to try to help change the tide here with all of this? I mean, is there anything that we
Everyone can do their part.
Right.
You can get involved at a nonprofit that serves mothers with maternal care. You can advocate for policy change to legislators. And if you can't do anything else, just show up and help educate a mother on what she can do during her pregnancy or help her get to a health care appointment.
Absolutely. Thank you both, Nicole and Thana. Thank you so much for joining us today and just for talking about this week is extremely important. So we want to thank you for helping us and our viewers to bring awareness to this.
Thank you so much.
For sure.